Hello guys, we are going to look at a topic in medical surgical nursing, Addison disease. Addison disease is an endocrine disorder. This is a rare disorder of the adrenal gland caused by the destruction or dysfunction of the adrenal cortex, characterized by failure of control of secretion of the adrenal hormone. It is a disorder in which the adrenal gland don't produce enough hormone. Specifically, the adrenal gland produces insufficient amount of hormone cortisol and sometimes aldosterone. 2. When the body under stress, example, fighting an infection. When the body is under stress, when it is fighting an infection, this deficiency can result to life-threatening Addisonian crisis, characterized by low blood pressure. The causes of Addison disease include autoimmune destruction of the adrenal gland, tuberculosis, congenital adrenal insufficiency, congenital adrenal hypoplasia, congenital adrenal hyperplasia, tumor of the adrenal gland, tumor of the kidney, malignant tumor of the hypothalamus, malignant tumor of the pituitary gland. The science and the laboratory investigation include the lab tests may show level of plasma and urine cortisol and elevated level of corticotrophin. White blood cell count. When the white blood cell count is high, it indicates the presence of the infection of the adrenal gland. Plasma cortisol test, adrenocorticotropic test to determine the level of hormone, chest radiography to check for tuberculosis, CT scan of the abdomen to show if the adrenal glands are calcified. Medical management. The treatment consists of replacing glucocorticoid and mineral corticoids. Cortisone is given in 2 daily doses. Example of the cortisone include dexamethasone, betamethasone. They are given in 2 doses. Treatment and management of underlying cause, especially tuberculosis. The tuberculosis can be treated with antibiotics, and prevention of tuberculosis is very important. The nursing management. The nurse monitor and reach the patient family. He monitor the patient and also encourage the family to be supportive in the care of the patient with Addison disease. Diet modification is made to include meals high in carbohydrate and protein. In some cases, patients may require additional sodium chloride. Frequent monitoring and recording of vital signs is important, especially the blood pressure. Patient is put on bed rest. Some of the clinical manifestations of this disease include hypertension. Patient can be monitored Vital signs of the patient is very important, especially the BP and the pulse of the patient. Another sign and symptoms of the patient is weakness. The patient may have weakness. The patient may have loss of libido or erectile dysfunction. The patient may have some signs of adrenal tumor signs. And the signs and symptoms can be managed symptomatically. Thank you for listening. Subscribe, like, and make comment. You are free to ask any question. Bye.